I am a family medicine trained physician, and I opened up this practice July 1st in Nashville, Tennessee. Let me see here, a little bio on the next slide. So, medicine's kind of taken me all over the country. I grew up in Seattle area originally, and then went to UCLA for undergraduate. I have a master's from UCSF in San Francisco in healthcare administration. I did that at the same time as medical school in Miami. So I used to fly back and forth every few weeks. And then came to Nashville for family medicine residency. And then opened up my practice here right after finishing residency. Um, and then my whole goal with creating this kind of a concept was really trying to restore what healthcare used to be. In my opinion, that's what, when I went into medicine, this is what I wanted to be practicing. And it was eye-opening throughout 11 years of training, how much it has shifted. So that's really kind of the origin of what I wanted to do here was like after 11 years of training, I did not want to just be kind of a cog in the big system. I wanted to do real healthcare, actually know my patients, be available for them, more of like the community doctor, so to say, kind of, which was, I guess, more old school before insurance and all these big corporate um, hospital entities. Um, and so this kind of, I found this diagram, and I guess this kind of really embodied kind of some of the issues that I saw in my training in the traditional healthcare system versus opportunities to really focus more on proactive care, which is what I'm doing currently in my clinic, focusing more on disease prevention as opposed to more of a reactive system, which we've kind of come to. And now it's kind of all throughout the traditional healthcare system of pretty much like once someone is sick, they go to the doctor. And mine trying to change more of the culture of you come to the doctor when you feel healthy and let me keep you healthy. It's a lot cheaper and easier on the preventive side. Um, so for just to kind of give an example too, in traditional healthcare, if I was going to be a traditional primary care doctor coming out of residency, my job option would essentially be seeing 20 to 30 people a day, ultimately trying to build a panel of 3 to 4 thousand or more patients that I'm responsible for, which leads to pretty much 10, maybe 15-minute visits at most. And patients who generally are already having chronic diseases that I'm dealing with now. And so very much on a reactive kind of a system there of like you come to me when you're sick. I only have 10 minutes to really, I don't have time to even really know you or like how you got here or what your lifestyle and habits are. It's more of transactional of I'm already coming into it with the mindset of do I write you a prescription or send you a referral? In primary care, we are trained across everything. So if I have time, I can actually do most things myself, but in a 10-minute time slot, I don't have time to thoroughly think about anything. And I am going to focus more on just how do I get you to where you need to go since I can't do it all myself here. And then that obviously kind of just passes the buck along. If you need to go see a GI doctor, that might take a couple of months to get in. And then meanwhile, your symptoms you're having are kind of also progressing. And so it really does kind of delay some of the necessary care there as well. And then there definitely is an increased cost with all of that as well. That I think has been one of the most surprising things since being outside of insurance and traditional healthcare, how seeing how affordable and honestly quite cheap everything is outside of the insurance system, which I'll show you in a little bit too, some price comparisons. Um, but that's kind of really where I'm focusing now is that if I think everyone talks about healthcare in a very mystified kind of like, what are we going to do about healthcare? Why is it so expensive? And they do have a lot of layers in the system in place, but truly at the end of the day, healthcare can be very easy. And that's what I'm trying to show in my clinic, where if you just go directly between the patient and the doctor, I could actually do a lot of things. If I spend an hour, hour and a half with each patient, get to actually know them. I can know what your lifestyle habits are. I can do full comprehensive preventive lab work and see years ahead of time before someone has symptoms and really start focusing on simple changes to prevent them from getting sick as opposed to, yeah, if they were to wait and see me 5, 10 years down the road have a major like heart attack or something, and then now they have a stent, now they're on multiple medications. That is a bigger cost both to the patient, to the system, to everything. So that's really kind of where I'm challenging the system of bringing it back to just more old school and simplified, where it's more just relationship based and more time based, which that's probably something that's missing in the current healthcare system too, in the direction that we're going in, especially with AI and all this tech. That is generally what people tend to gravitate towards in corporate healthcare and all these big systems of like, oh, we need more AI, we need more efficiency, we need more of this technology to make things faster and quicker. And I kind of argue, and that's what I'm doing, is the exact opposite. I just need time, which is more old school. That's not a very shiny or sexy topic though. Like it's not a product. It's just I just want time with my patients so I can keep them healthy. But I do think this will keep my patients a lot healthier, save them a lot of money, and also save the system a lot of strain down the road. And so I'm hoping that eventually we can kind of scale up this kind of a model and make healthcare really what it can be and what it should be. So I think on my next slide here, these are just some pictures
Rahul,
of,
may I interrupt?
yes.
Kavante wants to know, is this similar at all to concierge offering? We work with a
Yes.
pediatrician for our 3-year-old.
Yes, so I get asked a lot about that, which generally, I mean, I think it's people know concierge medicine quite well. So I tend to be like, yes, it's similar to concierge, but at least here in Nashville, I've worked with pretty much every concierge doctor that's in town here. The difference is that they generally tend to charge around 8 to 10,000 a year for a membership fee, which that generally caters towards people who are 50 years of age or older who can actually afford that price point. And generally, that's people that at that point already may have some more chronic diseases. So they're kind of helping manage that more. And so it's more so on like having that same kind of relationship with your patients, but not as much focus on preventive. It's more on kind of management at that point. It's also doctors that are generally practiced in the system for 20 or 30 years. And then they end up just switching to concierge and taking their 200 people with them. And then that's really it. They're not trying to scale or try to make it any bigger. And they're very happy just having their 200 patients. Um, and so that's kind of where I am actually pricing it to make it more affordable and tailoring it really more towards people in their 20s, 30s, 40s, and making it affordable, accessible for them. So I can really focus on simple lifestyle and early access and disease prevention there. So the exact opposite end of the spectrum, really. But that's my goal too, to scale and kind of bring my colleagues on board, have more locations, and have more of this as an option for healthcare. That's really my biggest goal, is that I want people to know that this exists and that they can choose to do this if they see value in it. And then this is just some pictures of my clinic. My background is actually in design. I've done design most of my life. So that's something else that didn't like in the traditional healthcare system, is that you normally go into I don't know, sterile doctor's environment. You're sitting in the waiting room for 30, 40 plus minutes, and then you finally spend maybe 5, 10 minutes with the doctor and they're kind of rushing around. And I personally didn't like being there as a patient or as a doctor. And there's no rule saying a doctor's office can't look like this. And so I've really enjoyed challenging healthcare design as well. And I truly do think this makes a big difference in health, both for my own health and also for my patients, where if it's more of a healing environment and more calm, inviting, and warm, and also just having time, like an hour or longer for each person, I get to actually know them. They actually tend to open up a lot more. I get to actually know some of their lifestyle habits, and you have more of an honest discussion there. And when it is kind of this warm, healing environment, they do get more comfortable. We do get some better results, in my opinion. And then on the right here, that is my body scan machine. I used to be a personal trainer when I was at UCLA as well, before I went to medical school. And so I've really enjoyed incorporating some more sustainable health coaching into my practice as well, and some more sustainable nutrition coaching. I use this body scan machine on all my patients to really just differentiate and show them too that weight on the scale at a certain point really is not useful at all for me, versus your body composition. That is what I base a lot of my management off of for some of the simple lifestyle changes and habits. So this pretty much, it tells me muscle mass, distribution of weight. I use it clinically too for any asymmetries that they may have. So if they have a pound more of muscle in their left leg versus their right leg, that's going to inform some of the exercise coaching that I recommend for that patient to prevent injuries and surgeries down the road. It also tells me metabolic rate, which is useful for nutrition planning and coaching there. So, and I'll talk a little bit more in a few minutes about my different membership options, but the premium, like the higher tier, I guess, that I offer is really incorporating more of the exercise coaching, nutrition coaching, and also having a personal doctor in one versus the standard is more of just the doctor part of it. All right.
Rahul,
Yep.
Devante thanked you for answering her question. She wanted concierge medical services from myself and partner, but could only afford the baby. We will be researching you further.
Oh, great. Yeah, I'm happy to answer any other questions you have too. I also, so like I said, I'm located in Nashville, Tennessee, but I do have a good amount of clients that are also in other parts of the country. I do think that the most valuable part is really getting to know my patients, and that can be done over video call, video conference. And then for blood work, I do all my labs through LabCorp, which if you're not able to come into the clinic and get labs drawn here. I can have your labs done at any LabCorp location in the country. And same with medications. I can call them into any pharmacy anywhere. I also do have a wholesale pharmacy and urgent care, everything in my clinic. And as long as it's not a controlled substance, I can also overnight ship it anywhere in the country too. But yeah, would love to talk to you more if you have any other specific questions about joining after the presentation. And then this is
And I have to make a correction. Cavante is a he. I made a
okay.
mistake. So
No problem. And then these are my two different membership options, like I was mentioning. I tried my best to make it as succinct as possible, but it's still it's more of a 5 minute conversation than like a one liner on a billboard. So essentially the standard membership, um, I've enjoyed the membership model where it really does encourage people to use me for any minor concerns. Or instead of Googling, like call me or text me directly. There is no extra charge for anything that I do. I like to give an example of a few weekends ago, it was a Saturday. One of my patients on the standard membership, he cut his finger open while gardening and he called me and was like, "Hey, I cut my finger open. Like, I don't know if you do this or not. Like, can you help me?" And I was like, "Yeah, of course. Like, come on in." I met him here in the clinic. I stitched it up in 20 minutes and it cost him an extra $4. That's all I charged him. And so he's someone that, I mean, he has insurance as well, but the insurance, his options would still be urgent care or ER, both of which it was just like a 5 stitches on his finger. He's not dying. He's going to probably waiting in the urgent care ER for 5, 6+ hours, and then probably still have a significant copayment or out of network costs or something associated with that. And then versus here, yeah, it's just like $4 extra. I actually know him at this point well, so I texted him a few days later too, making sure, just checking up that everything was healing well, and it did. But really just having that level of access and making it easy. Or like I have an example of one of my other patients had a sore throat and texted me like, "Hey, can I come in and get a strep test?" They came in, did a strep test. It cost $3. It was positive, so I gave her the antibiotics, and that was around the $3, and she was gone in 10 minutes. But really, they try to make healthcare that easy and accessible. And I do think that if people had that level of access and were able to just even I don't know, ask about minor things, people could stay a lot healthier and really avoid what I used to see a lot of people just putting it off. I'm like, it's not worth going to the urgent care for this. I'll just put it off, put it off, put it off, and then become something major and then I'm in the ER. And again, all stuff that we could have easily prevented if there was more access in the healthcare space, especially on the preventive side. Um, and then I also do a full comprehensive kind of annual physical on I know it says on here, I just do those limited labs here, and then all the advanced testing is included only in the premium membership. But I have done that full panel with the biomarkers, everything as well, and over 100 people so far, and I've only had 3 or 4 people have a fully normal panel, and these are all young, healthy, fit. They feel fine, but they all have things abnormal in the lab work well before they have symptoms. So when I first started seeing that, I was like, okay, I'm just going to switch to having everyone do all the lab work. I just give them at cost this entire panel, even in the premium, doing that entire blood work panel. It only costs $200 when I order it. It's almost $2,000 even with insurance because insurance does not cover preventive care. And I'll show you that on the next slide as well, just as a comparison and breakdown of cost comparison. Anyone have questions about my membership options here? Oh, I think you're muted, Michelle.
Yes, I am muted. Sorry about that. We do have a question. If you have a hereditary disease such as sickle cell that needs specialty doctors, could someone work with you and still have traditional network-based coverage for other medical needs?
Absolutely. And I was going to clarify too that I'm not insurance. So insurance does have a role, which I'll talk about in a little bit here. But especially for something like that, where if you're going to be seeing specialists regularly, I'm happy to help coordinate that. I'm also happy to do more, again, the preventive care and preventing any other issues or talk more about ways to keep any chronic illnesses you have at bay and best treat them. So again, I really do think it's the most valuable aspect of it is just having a doctor that knows you in your back pocket that you can call or text at any time. And then, yes, if you need any specialists or need help with anything there, I do help manage and coordinate all of that care and then also keep a record of it just so everything is in one place. All right, and you can.
Who would you not take as a patient?
So it's always more of a conversation. I don't have any kind of like, I guess, criteria of like I don't take people at XYZ. It's really just seeing if it's a good fit for both of us. I always have people come in for a free consultation, see the place, talk to me, see if it's a good fit on both ends. But truly, I
Okay.
think anyone could be a good patient.
And Kivante has another question. Outside of the monthly payments, do you have an option, maybe yearly, for drop-in visits for members that may only need a few contacts with provider throughout the year?
You mean like if they didn't do a membership, if they wanted to just come in and do once a year visits?
Um, I'm not quite sure. Kavante, do you want to unmute yourself? Oh, yes, that's what he said. Just a
Okay.
drop in, pay as you go.
Yeah, and so I dabbled with that when I first opened. And then I dabbled even with just doing one-time blood work. But the issue I kind of kept running into is that if I did the entire blood work panel on someone and didn't know them and didn't have that kind of relationship with them, I'm not even sure really how to interpret the labs in a way that's useful to you. Um, I give my mom an example. Like she always has high cholesterol. She goes to the doctor every year. They always tell her that. And then the doctor always tells her, cut out red meat and fried foods. And she's been vegetarian her entire life. So it's something where, like, if I don't know you and I'm looking at your lab results and it's just a one-time kind of a visit, I don't really have a baseline of what you're doing currently in your lifestyle or what your health goals are. And same with the one-off kind of just one-time visits, if I don't really know you before that, and you're coming to me just in a time where you are sick in a one-off visit, I don't really know what your baseline is, and that's probably not the best time for me to get to know that either. And at that point, that doesn't really differentiate me from just being an urgent care, which is not what I want to promote. I am an urgent care for my patients when I know them. Like the guy that cut his finger open, I had already known him. We already did his labs. I already knew everything about him and his lifestyle and all that. So it made it more, I guess, more comfortable in that situation as opposed to that was my first time seeing him. I don't really know him besides just being a patient, which again, that doesn't really make it any different than any other urgent care or ER where you are just, it's a transaction. I hope that answers the question. If not, we'll have plenty more time for questions too. And then I wanted to show you guys some of my pricing and kind of break it down. There's a lot on this page, but just for example, so on the left here, you'll see all of the different, this is just a sample. I mean, I can order any lab that you want. This is just an example of some of the most common labs that I tend to order on people. Everything is very cheap outside of insurance. And then same with medications as well. I thought with medications that like a $10 copay with medications was probably a good deal, but it turns out everything's also a few dollars. And I have a whole pharmacy here. Obviously, no controlled substances, but anything else is very accessible and cheap. So, I'll talk more on the next slide about insurance versus preventive care, but does anyone have any questions here about any of the labs or pricing? Cool. All right. So this is kind of my biggest, I guess, differentiating and just as a concept that I talk to people a lot about of health insurance versus what I do in preventive medicine, where I find that health insurance is a lot like car insurance, where it's good for those major car accidents, like those anything major unexpected events there. But in terms of keeping you healthy, that's not really the role of health insurance. The same way that car insurance does not cover your oil changes or your tire replacements or your car washes. Like those are all things that you have to pay for yourself. And so that's essentially what I'm doing is more on the preventive side is before someone even has symptoms, like let me keep your engine in the optimal shape before anything, you wouldn't even notice anything's going wrong with it. As opposed to the traditional system is more of a, once the engine starts making a weird noise is when you go in and then they try to their best to fix it. So really more on the preventive side there. Insurance does have its role for those kind of unexpected major events. Or if you're seeing specialists often or in or out of the hospital, please have insurance, but still very different than preventive medicine. Even if you do have chronic diseases, there's still things that we can do to optimize your engine functioning, with that analogy, before it becomes more of a major concern. Do people have any questions about these two differences here? Oh, I think you're muted, so.
No, but we do have a question. Do you offer yearly STI testing for members?
Yeah, well, I have from STI testing at any point on this last slide here. You can see that STI testing is $45. So they can come get that whenever they'd like. And everything here, I believe in full price transparency. I still don't understand why we get surprise medical bills and get medical bills from all different groups and people. And um, so everything I do, like my price is your price. I don't get paid or incentivized or anything to prescribe you anything or do any labs on you, or this is all more of a if you need it, I have it. I only get paid by the membership. And so I've enjoyed having that level of transparency where it doesn't, that way it's very clear of like, and you know exactly what the cost is when you leave. You're not going to get any surprise bill in the mail later. And that way what we're doing and working on together is actually what I would recommend you need, not something that would potentially be seen as me being incentivized to order things on you or give you supplements or medications that you don't need. All right. And then I just wanted to touch briefly too on this concept applied for employers. So I do partner with a lot of small businesses in town as well. Just to, again, this is an option for healthcare. That's my biggest goal for individuals and also for businesses. So this again, this applies mainly to small businesses. For employers with more than 50 employees, you do still have to get something that's at least ACA at that level for insurance, and you could still even offer this on top of that. But especially for small businesses, it is a significant cost to offer health insurance for employees. And unfortunately, it doesn't do much to actually, I know we talk about it as a benefit, but it doesn't benefit most employees, especially ones that are younger and healthier. Again, it's like giving them that car insurance. We're like, yeah, if they have a major accident, that will cover them, but it's not going to keep them healthy. And it is a very big cost to do traditional marketplace insurance. So I know I have a lot of numbers on the screen here, which you guys can read that. But I know in general, marketplace insurance roughly is 300 to 500 plus dollars a month. The issue there is that it's not preventing any illnesses. And then if someone has, and your own your employees has an acute illness, like say strep throat, for example, they're unlikely to get into their primary care doctor for at least a week or two. So their options at that point are going to an urgent care or walk-in clinic or an ER. And those are all going to most likely be a very long wait for the employee and also an out-of-pocket, some kind of a cost there. One of my patients told me that they had to spend $400 to get a strep test at an urgent care, which is crazy because I told Joe that was $3 for that test. And at that point, the employer is paying a lot of money for them to have health insurance. The employee is still also paying co-payments and not having access to care, nor are they staying ahead of any preventable illnesses as well. And so in that kind of a model, if your employee's covered if a major car accident happens, but again, a lot of times with major car accidents, like if they have a heart attack or they have to be hospitalized for uncontrolled diabetes, those are all things that we could have easily prevented. And then they're not gone for a week or two in the hospital or recovering or waiting to get into their follow-up visit. So for the employer, that's also less loss of productivity due to sickness. If you call or text me, I can see them the same day in my clinic and get them feeling better with no copays or additional costs or minimal costs. And then for the employer, they get back to work faster as well. So really, this is a good option for individuals, but also for especially for small businesses. Any questions about this? Perfect. Yeah. And this has kind of been my last big push too of marketing and awareness just before open enrollment for insurance comes up. I think in gosh, about the next week or so. Just really trying to make this aware that this is an option for true healthcare, like on the preventive side, as opposed to the insurance, which is going to be more on again, those major unexpected things. And then this is just kind of an example of, I have a lot more examples on my website as well. I know this is a lot going on here, but just some price comparison examples here of doing membership with different options, like either paying with health insurance. Like on the left side is like if someone just pays out of pocket for insurance, $380 a month, the kind of care they would get there with co-payments, a limited annual physical, having to go to the urgent care or putting it off care and getting infected. And then the total cost there per year versus doing the membership, getting more of a full comprehensive panel there, kind of an understanding. Like food allergy has been a big one that a lot of people have abnormalities and don't even realize it. So actually improving their health without realizing it, and staying healthy. So pairing that with either a lower level medical plan that's around $150 a month, or even doing a health share or critical illness plans, which are around $60 to $80 a month. Which again, those are really there to cover for those major unexpected events. But for people that are otherwise young and healthy, I mean, that's really the role of insurance is for those big things. Paying more than that doesn't really equate to any better healthcare, especially on the preventive side, especially for people that really are only going to the doctor once a year for an annual physical. Insurance-based physical really is only two, maybe three, at most four labs that insurance covers, which again, that is not the role of insurance. It's not designed for that. It's really designed for those major unexpected things. So it makes sense that they don't really offer more comprehensive preventive care. Questions about any of this? Perfect. And then yeah, this is just my contact information here. I'm going to leave plenty of room for questions or I know it's again a different concept than traditional healthcare, but that really is my biggest. What I've really enjoyed doing is real healthcare and spending most of my time with patients, not documenting or on the phone, calling insurance companies or calling pharmacies and all that. It's really just more of a personalized approach and more old school medicine in that way, which I think is what healthcare really can look like. It really is easy being outside of these big systems. It's just that I didn't know this was an option until I started doing it. And so that's my goal is just kind of raising awareness and education about this kind of a concept and that there are options out there.
Wonderful. Um, we have, let's see, somebody was asking from an employee aspect regarding taxes, do they get hit with fees by federal or state government if they opt not to pay for health insurance? Or would a membership prevent having those penalties?
So I am not an expert on this, but from what I've seen, it really does depend on how many employees you have. So for small businesses, there is it should not be anything it might depend state by state too. In Tennessee, for small businesses, they're allowed to kind of do whatever they want. They're not required to offer health insurance. It's more when you have 50 employees or more, you are required by the federal government to at least have that minimal essential coverage for health insurance. But um, in terms of taxes, this is actually a tax benefit for employers too, where they can either, I mean, if you pay for the membership for your employees, or if you want to cover one-off cost, let's say someone has to go to the ER, something major, and then there's a $5,000 bill, you can reimburse that. It's called a health reimbursement agreement, or an HRA for employers, and so that's something that they can cover that one-time cost, and you can expense that to your company, and that's reimbursable, and it's a tax benefit as well. But there are a lot of options in small businesses for employers to offer their employees better benefits that are unique benefits, but it does save them taxes and it does actually keep their employees healthy. But there are a lot of options there. The bigger businesses, less flexibility there, but I also say to anyone that is an employee and your employer is paying for your insurance, especially with open enrollment coming up, I know that the comparing plans is I try to deep dive in it and it's very confusing, but if there generally is like a regular plan, a premium plan, and then like a bronze or lower level plan with an HSA or a health savings account. I've been recommending to people that are otherwise young and healthy to consider that the HSA plan, and you can use that to pay for membership. And that's essentially money if your employer is paying for it. Anyways, you may as well get something with that money and stay healthy. I'm not sure if that answered
Okay,
the question.
got it.
But yeah,
So,
this is HSA eligible as well.
so is there an option for family membership?
There is. So I'm family medicine trained, so I am trained in seeing children, but I don't have the full capabilities here to truly see like infants and toddlers. I do recommend for those families to still have a pediatrician for those well child visits, for vaccinations, those kind of things. And then for any kind of acute or one-off situations, or you're not sure if you should take them to the ER or not, I tell them to still just call me. I'm not going to charge anyone under 18 a membership there. And then yeah, I do have some flexibility there. And if you and a spouse and then you have two kids, something like that, like I am flexible in my pricing as well to accommodate that. And then I'm also happy for any small business owners out there or self-employed or anyone else that's needing any financial assistance to offer a 10% off discount off membership.
Hey, any other questions? Well, lots of information.
Yeah, I was
If
gonna
there are
say I
additional,
know. It's a
yeah,
lot to digest at once, but yeah, I do have a lot more information about it on my website, which is membershealthco.com, or on my Instagram, which is just membershealthco. And then would love to hear from you guys too if you have any other questions or if you're in the Nashville area and want to come by and see the clinic in person, happy to have you come by for a free consultation.
oh, excellent. Let's see. So Phyllis says, I'm definitely going to be reaching out to you both in a personal matter as well as professional. Every single solitary thing you have discussed today is of particular interest to me, and I love your membership model. So I'll email you later today or tomorrow, but I will be in touch. This is on a
Great, thank
funny
you so
note.
much.
This is on a funny note, but I'm on my way to LabCorp facility now to have blood work done.
Oh, that's funny.
Very good.
Well, looking forward to
Uh,
talking to you more.
got it. Kavanti, there was a slide that talked about the difference between the basic membership and
Oh,
the premium membership. I'm going to be sending out these slides to you all. It may not be this afternoon, it may be tomorrow, but you will have them so you can print them out and study them. And again, you can call the doctor and ask for questions, ask
yeah,
them
and these are all
questions.
just excerpts from my website too. So my website does have all this information, and then more as well. If you have any specific questions about the two plans, happy to talk more about it now, or if you want to reach out later too, happy to elaborate on that.
So, oh, Phyllis has been screenshot shooting them. I'm sorry, I should have said that at the beginning of the webinar. Uh, Thank you. This was an aspect to learn. Do you know anyone doing something similar in Atlanta?
I don't. Well, so this isn't like a brand new concept by any mean. I mean, it's similar to concierge. It's similar to it's more old school medicine, but Direct primary care, that's probably what this more falls under compared to concierge medicine. But I would look up direct primary care and see if you can find any providers in Atlanta if you're looking for something similar. I will say with direct primary care, I have worked with, there's not many in Nashville. There's only two in Nashville area. They're down in Murfreesboro or in Hendersonville, a little bit outside of the town. But everyone is different. So it's all, you're going to get a very different flavor and a different clinic and a different approach. They might do very different workups. There really is no standardization at all with direct primary care, but it is something where it's a similar, you have to just kind of find the right doctor that's a good fit for you and what you're looking for. But that is more of the model. And I'm looking more to just kind of scale this up and bring my colleagues on board and make this more of a standard for care. If you live in the Atlanta area, though, like I said, I have a lot of patients that do not live in Nashville that I also enjoy seeing. It really is just more of once I know you and you have access to me and call me or text me with anything, most of primary care can be done remotely. Um, so it's something that can still be an option we can talk about as well.
Okay. We have one from a business owner standpoint. I'm curious as to how many staff members you have. I'm also in the DTC market, but in physical therapy space, and currently am a solopreneur. Who was your first hire?
Yeah, I have one full-time employee. She's my office manager and front desk right now. I used to work at an old clinic with her and I stole her. She's great. So she's been really helpful to have on board. I do have a part-time lab tech to draw blood work. And then I'm actually planning to expand in the next couple of weeks here and expand my square footage and then bring on farm to table food, try to make healthy food more accessible in the community. IV hydration, Botox, but done the correct way without toxic amounts of vitamins in the bloodstream, but and really just educating more on how cheap it is to actually get your vitamins checked and not you don't need it all in your bloodstream. You can just but it's really kind of targeting that kind of a clientele to come talk about primary care and preventive care. So when I start launching those memberships there in the next month or so, we'll definitely be bringing on some more 1099 employees as well to help with staffing for that. And then aiming for another provider in the next 6 months or so, which might be a little soon, but we'll see.
We have people saying, thank you, great information.
Yeah, thank you guys for listening.
And we have Phyllis says, hire me. I'm a registered, I guess I can't read the end of it, registered dietitian.
Oh,
So
great. Okay, we'll have to talk more about that.
excellent. Okay. Is there anything else anyone wants to ask the doctor? Let's see, any advantages? Let's see. Well, my computer is giving me fits here. Okay. Are there any cases where your type of practice would not be appropriate?
Do you have anything in mind that you're thinking of with that question or?
No, it was just, are there any types of cases you might?
Like that aren't a good fit. I mean, like I said, it really does go back to like if it is a good fit or not. For the person, there's no like umbrella statement of like this kind of person wouldn't do well here. Um, I mean, like I said, I do generally, I'm targeting more people that are younger, healthier, to keep them healthy. But I do have a lot of patients that also have a lot of chronic medical conditions, and I can help manage those because I have time. So there really is no like this population is not like a fit. It's really more on an individual level. If someone, um, yeah, finds value in it and we have a good it's a good match on from for me for you that's I think that's kind of how I go about it, but really anyone is welcome here. I enjoy treating all different kinds of conditions. Like I said, primary care, it's been great. I actually know a little bit about every part of medicine. I also have time to research things that I don't know everything about, where I text my colleagues and get you answers instead of sending you a referral, that kind of situation as well.
Okay. So I think you answered, what about geriatrics?
Yeah, I can do geriatrics as well. I will say the one population where I would recommend, again, it's not like that you can't see me, is it's just that I would recommend having another physician involved as well is prenatal care, and pregnancy care. I would recommend having an OBGYN for those, to help more on that. That's their specialty there. Still happy to help coordinate all care there in the meantime and focus on anything else beyond OB prenatal that can be optimized and keep you healthy there. But that's probably the population that I would recommend having another physician on board for that management.
Very good. And Mildine said, wish I could find this model in Maryland.
Yeah, hopefully we could expand up there in the next couple of years. We'll see.
And another question, any advantages or disadvantages of paying for HSA first versus doing direct, meaning enrolling HSA to pay for membership versus not?
Well, so that's more of just if your employer is paying for that anyways and contributing money into your HSA, that's money that essentially it's you're getting it through your employer. So you may as well use it to get something from it. But there's absolutely you totally can just pay for it yourself as well. For people that are more financially savvy, they don't want to touch their HSA and let it grow tax free till they're 65. Also, totally fine. They just pay out of pocket. But I also think if it's money your employer is giving you, you may as well use it to get something from it. And so, but it really just depends on what's going to be a better fit for you. I also have to make people aware that it's an option to use an HSA.
Okay. If extensive functional medicine panels and kits are of interest, is that something you also do in-house or refer out for?
Yeah, so I partner with Genova, which does a lot more of the advanced functional medicine tests. I do like to still start with what I've listed on here with like the full, this is a really good blanket panel that I like to do and start with, and it's $200. And it's really going to tell me a broad spectrum of like your entire health, doing vitamin, hormone, biomarker testing, cortisol, food allergy panel, inflammation markers. And so it's going to tell me which direction, if we do need any further testing or advanced like specialty testing, like where to focus that on. Those are probably 2 to 300 a ballpark each. So, I mean, we can certainly do all of those advanced testing too, but I like starting with just the most bang for your buck, essentially. And like I said, I've had over 100 people get labs, and only 3 or 4 people have had a fully normal panel. So everyone has something abnormal that we can already start working towards. And if once those are normalized, or once we've kind of addressed those, if they're still having any symptoms or concerns, absolutely can order any other tests here. My biggest thing with everything is always why are we doing it and what are we trying to accomplish with it? I like to make it more of a conversation with everything, not just I'm ordering this for you or like we're doing this. It's always going to be more of that dialogue. But yes, I do have my advanced testing available as well. I forgot to mention too, I know imaging is something that I get asked a lot about. I should have put that on here in the slides, but it is on my website. But I can order any imaging that is needed the same day without any fuss from insurance, and it's just the price, it's the cash price. It's through Premier Radiology. Everything is, I would say, let me actually pull it up. I think a CT scan is $550, and I can order that today as opposed to in my traditional previous practice, that would generally take at least a week, normally 2 weeks to get insurance authorization and approval and a lot of back and forth. And then a lot of my patients then still had to pay 300 something dollars as a co-payment. And then at that point, we've also delayed the care by 2 weeks or so. And then say MRIs, especially, it's only $600 for most MRIs. And I can order that today and not delay care. It's more of if you need it, there we go. And that's again my price is your price. Versus in the traditional system, that can take up to a month to get approved. They want to order a CT first and get the MRI after, and then it just ends up getting pushed down the road. And yeah, it really just kind of delays some of the care that is needed.
So let me ask you, if I need a CT scan. Would I pay you and then go to get that done and or
You
how?
just pay them directly. I'll just schedule it though on the same day or whatever location you'd like, or whatever time works best for you.
Okay,
And then you would just pay them directly the cash price.
got it.
I generally get those results back sometimes even the same day, but normally the next day or two at the latest. So it really does expedite it getting imaging back. And that was what was interesting outside of the system too. I didn't know it could ever be this quick and easy to order imaging. It was normally like I would order it, then like my front office, someone would send it, or the nurse would send it a couple of days later, and then get the insurance and all that stuff. And then all I know is like I'd get the imaging results back, I don't know, a few weeks later or something. Versus here, I'm like, oh wow, it really is this easy. Same with labs and everything too. I'm like, it's just been great to see that it's so easy and see those results and see improvements in patients before they even have symptoms. And really, my biggest goal is that.
Okay. Dr. Iyengar is way ahead of the curve compared to his peers in the healthcare marketplace. Appreciate SCORE putting this webinar on. Please bring him and others more on the health focus.
Thank
We
you
will
so
have
much. I appreciate it.
the doctor back again if he's willing, so we can spread the word to more people. Thank you, Michael, for your comment.
Yeah, I would love that.
Okay. Anybody else you'd like to contribute or have a question you'd like to ask? We have thank yous and thank yous. So, and I personally want to thank you, Rahul, for being here and your excellent presentation. And I know people are going to appreciate the slides and be able to look at this more in depth. And your website's beautiful. You did a great job, or whoever your developer was.
Oh, thank you.
And
A lot of figuring it out. So
yeah,
I made it all myself. I was like, I'll figure it out. It's just, the entrepreneur spirit.
it's
But thank you.
really, really excellent. So if there is no further comments or questions, I want to again thank you, Doctor. And ladies and gentlemen, have a great rest of your day.
Yeah, thank you for having me.
Absolutely. Bye, all.